Hi, my name is Diana, and I'll be talking about continuous glucose monitoring devices in this video. And here are the objectives of this presentation. Be familiar with CGM, know different parts of the CGM devices and their functions, and compare and contrast different CGM devices, and make recommendations on CGM devices based on their accuracy. So what is CGM? CGM is a method to monitor glucose levels throughout the days and nights. The monitoring system takes glucose measurements at regular intervals, 24 hours a day. Some are 5-minute intervals and some are 15-minute intervals. Then they will translate the readings into dynamic data, generating glucose directions such as the trends including highs and lows. A CGM device has 3 parts. A sensor, this is inserted into the skin such as tummy, arms, and thighs, and worn for a few days, then disposed of. It senses how much glucose there is in the interstitial fluid, which is the glucose found in the fluid between cells. Then the sensor connects to the transmitter worn on the skin, which communicates with the receiver, usually wireless nowadays. Then there is the receiver. The receiver records the glucose level and in most cases displays the end result immediately. The latest systems can use a compatible mobile phone as a receiver, saving costs and the need to carry an extra device. Systems that display immediate results are often called real-time. Here are just some examples of the parts, and they vary by different devices. So the current situation. According to Senseonics, which is a medical technology company focusing on the development of glucose monitoring systems, there are 7 out of 10 patients with type 1 diabetes don't use CGM devices, or CGM. Numerous reasons are involved, such as perceived burden of the use, fear of pain or discomfort associated with the application, and the embarrassment associated with wearing since it is noticeable by others. And 27% of the patients discontinue CGM use within 1 year of initiation. Some of the reasons are listed in this table, and the number 1 reason is that CGM not working properly or not accurate enough, and followed up by problems with the adhesion and insertion process. However, we do know that CGM can be of a tremendous help to the patients because it provides ongoing timely feedback. Unlike a single reading from a blood glucose meter, a CGM provides a real-time dynamic information about the highs and lows of glucose levels. It improves the glycemic control by having continuous feedback on diet, exercise, and insulin requirements. CGM can help to make more informed, fast, and proactive treatment decisions before you begin to feel symptoms, rather than reactive responses. Fewer finger sticks, no more finger sticks before or after meals, and CGM devices only require replacing sensors every few days, and much less than manual self-glucose monitoring. So, who are the candidates for CGM use? Patients require 3 or more insulin injections per day or wearing a pump, or they require 4 or more blood glucose tests per day, patients with hypoglycemia unawareness, or they don't have any symptoms during a hypoglycemic event, or patients with hyperglycemia. So let's compare some of the devices on the market right now. And first of all, here's just a brief FDA approval timeline for the most commonly used CGM devices. We have Dexcom G5 approved in 2016, Freestyle Libre approved in 2017, and Medtronic and Dexcom G6 are both approved in 2018, and we have Eversense approved in 2019, just a couple of months ago. And here we have an overview of the CGM devices. CGM devices do have a warm-up time after each new sensor placed. The Dexcom and Medtronic and both have a warm-up time of 2 hours, and Freestyle Libre has 12 hours, and Eversense has 24 hours. Just to note, the Eversense is a newly approved CGM device that is implanted in the skin, and each sensor lasts about 90 days, which is the longest out of all CGM devices. Other CGM sensors last about 7 to 14 days. Only Dexcom G6 and Freestyle Libre do not require sensor calibration. All others require calibration, which is done by using a finger stick method. One thing to keep in mind is that only Dexcom G5 and G6 are FDA approved for pediatric population from age 2 to 18. Medtronic is FDA approved for patients aged 14 to 75, and Freestyle and Eversense are both approved only for patients aged 18 and older. Direct accuracy comparisons between different CGM systems are uncommon and typically require patients to wear 2 or 3 sensors simultaneously. Yet there was an oral presentation at the 2018 ADA 78th and Scientific Conference looking at the accuracy of Dexcom G5, Freestyle Libre Pro, and Eversense. The study was done for 6 weeks in an outpatient clinic and involved 23 adults with type 1 diabetes. They all wore 3 CGM devices at the same time, and primary outcome was the mean absolute relative differences, abbreviated MARD, which is the average of the absolute error between all CGM values and the patient's reference. As we can see from the table, Eversense had the lowest MARD, with Freestyle Libre Pro being the highest. Stats were only significant between Eversense and Freestyle Libre Pro. They also ran a 2-way comparison between Dexcom G6 and Eversense because they both measure every 5 minutes, therefore they could obtain a larger set of data. And the Freestyle Libre Pro measures every 15 minutes. And from this, we can see that Eversense also had a lower MARD and was statistically significant with a p-value of 0.008, but I would say it's probably not clinically significant. Another study was done by Welsh in 2019, looked at the accuracy of Dexcom G5 and G6. This study performed an analysis of the 2 separately conducted studies of Dexcom G5 and G6 and assessed real-world outcome by using a convenient sample of 10,000 set of data from a database where patients can upload their glucose levels. They also looked at the MARD and percentages of CGM values. Propensity score was utilized to balance baseline demographic characteristics between the 2 studies, and the adjusted scores were very similar, which means the studies were similar in terms of their design and patient characteristics. Both systems had high real-world utilization rates of 93.8% versus 95.3% in the G6, and G6 was associated with fewer glucose values less than 55 and more values between 70 and 180, though they were statistically significant but maybe not clinically significant. Since we are on pediatric rotation, we will definitely have to take the parents' perspective into consideration on their use of remote monitoring using CGM in their children with type 1 diabetes. The purpose of the study was to explore parents' everyday experience of using CGM technology. They performed face-to-face interviews with 20 parents whose children were diagnosed with type 1 diabetes for more than 1 year, and the kids' age ranged from 2 to 12 years old. They all used Dexcom G5, and data were then analyzed using thematic analysis, which is one of the most common tools for qualitative research, where it emphasizes pinpointing and finding themes within the data. And here is what they found, mostly psychosocial related. They found that the use of CGM devices has improved their quality of sleep by not having to wake up multiple times during the night to perform fingerstick checks. It gave them a peace of mind at night, as well as during the day when their child wasn't at school or not with them. It gave them more freedom and confidence, and some say it helped to reduce their anxiety. However, some reported increased level of anxiety due to being overwhelmed by the use of new technology. The use of CGM also improved communication between various people who were taking care of the children, and it can also lead to conflicts as well. And according to the study, even though participants felt better due to reduced anxiety, better sleep, and increased peace of mind, they also reported a burden associated with the use of CGM, such as the bulkiness of the transmitter, having to carry around a receiving device to be able to see the glucose values, concerns about the system's accuracy. These experiences will hopefully be resolved over time as devices are likely to become smaller lesser noticeable, and more accurate. And these findings can definitely provide a starting point to help parents to decide whether this technology should be utilized for their children. And in conclusion, though Eversense has better mark compared to G5, it is not approved in pediatric population, and the use requires an invasive implantation procedure. And therefore, for pediatric population, Dexcom G5 and G6 are better choices, and the accuracies were comparable between G5 and G6. Yet G6 does not require calibration with a sensor life of 10 days, where G5 requires 2 times per day calibrations and 7 days sensor life. And here are some references. Yeah, thank you.